Warning, the following program has been rated T for truth.
You can't handle the truth!
Oh, we think you can. Welcome to the Naked Truth Report with your host, truth warrior and mythbuster Kathleen Wells. The place where we distinguish fact from fiction, where data is used to drive points home, and where Kathleen takes the position that Democrats and black politicians have destroyed black America. Welcome to the Naked Truth Report. Now, your host, Kathleen Wells.
Hi, Truth Warriors and Mythbusters out there. It's me, Kathleen Wells. We're going to talk about opening up Los Angeles, getting rid of the lockdown, why we must do it. And I'm going to be joined by two guests, James Enstrom and Rajiv Bhatia. But before I bring on my two guests, I want to share a story with you. Remember last week I talked about the secondary impact of COVID-19. Well, this story it relates to that directly and indirectly, both. So not last Friday, but the Friday before last, let's see, I've been having my kitchen renovated. So my back door is not secured properly. It's like a mock door because the back door is not in the door frame. It's sort of like a fake lock on the door. And it enables my general contractor and his workers, which is generally his son, to go in and out of the back door. So, and he also hired a subcontractor to do the cabinet. So, not last Friday, but the Friday before last. Now, you guys know I get up at 5:30. I'm an early riser, so I get up and what do? I watch Washington Journal. Yes. So I'm up at 5:30, 5 o'clock. The TV's loud because probably my hearing is bad. And I'm in the bedroom in the front of the house. The kitchen's in the rear of the house. So at, I'd say about 7 a.m., I hear, I have plastic from the ceiling to the floor, sort of dividing the kitchen and the dining room and the bed and the living room. So I hear this swoosh, like a swishing sound. And then I hear these footsteps. Do you hear me making footsteps? I hear footsteps. This is about 7. Now, I've been up since 5:30 watching Washington Journal. I didn't hear anything. But at 7, this is what I hear. So I say, hello, I hear you. I hear you. I have a gun. This is what I say. So then I lean over. There's a dresser by my bed, and I have 2 of my dad's guns in the dresser. So I lean over to pick up one of the guns, and the handle to the gun crumbles in my hand. I mean, that was shocking. But anyway, so then I walk I get up and I feel, my adrenaline is sort of pumping. I'm like, who? I know if it were Roberto, I said his name, I shouldn't have said, if it were my contractor, he would have said, hi, it's me, Kathleen, right? Oh, it's me, he would, because I've been working with him for a long time, and he would have said, oh, it's me. I said, hello, I hear you, I have a gun. So then I get up, I'm saying, oh my God, someone's in the house. So I get up, my adrenaline is pumping, and then I rush to the living room, I go through the dining room, and I go to the kitchen, and I see the back door is open. Because I knew I had heard footsteps. I knew I heard that swishing of the plastic paper that is demarcating stopping the dust from the renovations from coming into the living room. So I knew someone was in the house. So then I see, oh my God, the back door is open. So then I go around towards the den, and I go around, and I have the gun in my hand with the crumbled handle. I have it in my hand. Then I said, oh my God, my heart is racing a little bit. I'm excited a little bit. I'm like, but I feel confident because I have a gun. Now, I don't know if there are any bullets in the gun. I've never shot a gun. I don't know what. They're my dad's gun. They're probably 100 years old. So I go into the den and I look in the closet thinking, oh, maybe he's hiding in the closet. Then I walk around. I look in the back bedroom. I come up towards I'm moving towards the front of the house again, and I hear my car starting. Literally starting, So I rush to the front, and I look out the front door, and there he is in my car driving out the driveway. I'm looking right at him. And I'm like dumbfounded. In fact, my mouth is open and I'm staring. I'm like, what? Who? What is that? Who? What? So 2-3 minutes later, I get on the phone and I call 911 and I make a police report and the police arrive, so on and so forth. But fast forward to about 6-7 o'clock, I receive a phone call or a voicemail saying, "Oh, we found your car. We found your car, and can you come and you can come pick it. You can pick it up at the place with the police. It's a police. What is it called? A police impound where they're holding it." So I call and they're not open because of COVID. This is Friday, so they're not open on Saturday. They're not open on Sunday. So I go Monday morning. They're not open. They normally open at 7 because of COVID-19. They open at 8 o'clock. So I go at 7:30 and I have to wait until 8. So I have to pay for those days even though they weren't open. And it's quite expensive. It was almost some $500 because you pay for the towing and the fees and the taxes and blah, 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 and all those days. But anyway, so then the detective asked me to come in and because all of the items, there was luggage in the car. All of the items of the guy who stole my car were in the car. He was arrested. His luggage, he had some tools, and he had some, just a bunch of stuff. His change, he had 2 cell phones, he had clothes, et cetera, et cetera. So the detective said, you have to come and identify. He had on a red cap. You have to come and look at some pictures, and also we have to take his items that, his luggage and his clothes. We have to itemize those things. They have to be taken into police custody. So I go to the police station on Monday after about 10 o'clock in the morning, and I'm looking at the pictures, and then the detective says to me, well, we had to let him go because of COVID-19. There's no bail now. There's no bail. So we let him go. We arrested him, but we let him go. I'm like, what? So then they said, but we're going to rearrest him because he entered your house. We arrested him for receiving stolen property, robbery, but now we're going to rearrest him for burglary, but we had to let him go. So anyway, that's the story I wanted to tell because that's the COVID-19. One of the consequences of COVID-19 is that because robbery, receiving stolen property is a felony, and they don't get bail. They don't get bail. They get released. And I said, and then they expect him to show up. I don't know. I don't know if he was headed towards the border. I don't know why he had luggage. Maybe he was sleeping in the car. But that's the story, and that's one of the impacts of COVID-19, that people were not given bail. They were released and given a date to return for their arraignment. That's that story. But now let's welcome my guest. Jim Enstrom has been on the show before. He was talking about, when he was on the last time, he was talking about fake science, how the science regarding air pollution is fake science. In fact, Jim has been sort of like penalized for not taking the fashionable view of science. And also my other guest is Dr. I want to mention Jim has a PhD. He's an epidemiologist. He has a PhD in epidemiology. And my other guest is Bhatia, who is a medical doctor, and he also has a master's in public health. So welcome, Jim and Dr. Bhatia, to the Naked Truth Report.
Thank you for having us.
Yeah, thank you.
Okay,
Kathleen.
You're very welcome. Let's start with you, Jim. First, I read your article. What is the title of your article? Let me see. It's right here. Flawed model show why COVID-19 policies must consider total mortality. Talk to us. Why is it necessary that the models show total mortality, Jim?
Thank you. Well, listen, this is a perspective that is not often brought up in this entire pandemic. And the reason it's important is because there is a lot of uncertainty right now on exactly the number of deaths that are due to COVID-19, because this is a newly identified cause of death, and it's just been assigned an ICD code, and there is a learning curve where the doctors are diagnosing and then assigning underlying cause of death to these deaths. And so there's a variation in exactly what the total is. And when I looked on the Worldometers just a couple hours ago, it's showing 68,600 deaths in the United States. But this number is still preliminary. And if you go back to the CDC website, which they update less frequently and less maybe in a rushed manner, it's only showing on about half that number of deaths, and the true number is probably close to what is being stated, but it needs confirmation, and these things need more than just 1 day to confirm, and so there's some uncertainty in the number of deaths from COVID-19. There's also some uncertainty as to whether these deaths are replacing other respiratory-related diseases like the seasonal flu or pneumonia or other respiratory diseases. And so it's important to keep the total mortality in mind, because that's what determines longevity, is the total mortality of people, not a single cause. And to give you an idea, the CDC is monitoring total deaths since February 1st is usually designated as a starting date in the United States for concern about this. And if you look at their tabulation as of the 25th of April, they're showing that the number of expected deaths from all causes is slightly greater than the number that have actually occurred. So the number that have occurred for all causes is about 97% of the expected number. And the concentration is in New York State, where the observed number is about over 1.5 times the expected number. But if you take out New York State, then the observed number for the rest of the United States is only about 93% of the expected number. In California, the number is about 98% of expected. Now, these are all preliminary numbers because they get updated every week, but they roughly cover the months of February, March, and April. And so what I'm focusing is to try to put this in a broader perspective in trying to look at what impacts the overall health. It's obvious that this is a new disease, and it's one that has created a tremendous reaction, which I think is appropriate for something that's worldwide and that's new. But because of the total shutdown of the American economy and the American way of life, this is really unprecedented. And so there has to be perspective on how this proceeds. And so one of the perspectives I'm talking about is total mortality. And if you'd like, I could cite a little more on how this relates to California.
Well, so Jim, what are you saying exactly? That if our total mortality rate is not dramatically changed, that means that the COVID-19 deaths are being overcounted. Is that what you're saying?
Well, I'm saying it needs to be put into total perspective. That if the total death rate doesn't change, then or doesn't change in a significant way, or only changes for a month or so, it doesn't really affect life expectancy. And to give you a comparison of what happened in 1918, when there was the Spanish flu, which was a major pandemic where over 600,000 Americans lost their lives when the population of the United States was only about 100 million. The life expectancy from 1917 to 1918 dropped by 12 years.
Mm-hmm.
It was 51 years in 1917.
I get you.
You see?
Yeah, I get it.
And then it bounced back in 1919.
Mm-hmm.
And what I'm saying is that was maybe the most serious pandemic that we've ever faced in the United States by far. And so even then they didn't shut down the economy because we were at the end of World War I, and there was no way they could do that. It would have been
well, maybe because of the war. The war may have been a factor too, to that why life expectancy had changed also.
Well, you're right. I'm not saying that it's entirely due, but that I believe is the major cause of it, and it also affected younger people. That flu, it affected younger people, and so that has a bigger impact on longevity than affecting the people that are here. Most of the cases and most of the deaths now are occurring in people around the age of 80 or so.
Right. So we know that it's not going to change the life expectancy because I think 80 or 90% are people within a certain age cohort, the older age cohort, right? In fact, I think I saw something that said less than 100 people under 25 had died, under 10 have died, and less than 1,000 people in the United States under 25 had died.
Yes, I think it's even fewer than that under the age of 25 have died.
So it's not going to change the life expectancy because, given the data that we know thus far, because the majority of the people dying are old.
Yes, so that's, in other words, there has to be some balance because of the total lockdown of the economy and the total, disruption of basically everyone's life in this country. And so my belief is that when you're dealing with public health, you try to look at the net effect on all things, not just dealing with one particular issue. And we've now zeroed in on who's at high risk: the elderly, the old, those with comorbidities, compromised immune systems, and we know the high-risk areas that are centering around New York City, and we other hotspots. But certainly, New York City has taken the lead on this. This is a tragedy for New York City.
Well, talk about California. Talk about California.
Okay,
Okay, go ahead, Dr. Bhatia.
Yeah, let me just sort of echo this issue around sort of balance and just bring in a couple of points. I mean, I think it's notable today that, California has less deaths than Connecticut. Well, why is that? Well, I mean, so first of all, I'm going to be humble enough to say that I don't completely know, and I'm not going to say exactly why, but there's a lot of reasons. Are we a healthier population? Are there things about the way we live and our environment that makes this disease not spread as fast? We don't really, is it because we did all of these things early? I think the real answer is we don't, I think we don't know. But to Jim's point, which I think is important, is that this experience is bringing up, a lot of really important questions and trade-offs that the general public that hasn't been able to help answer. We've had decisions made by a few people, generally experts and bureaucrats, for us, and they've been directed to us, and they involve explicit trade-offs. The unemployment that will come from the response to COVID will also lead to death. It will lead to homelessness. It will lead to poverty. All of those things are killers, and they will happen more in the younger population, whereas the death to COVID is going to happen in the older population. So there's an explicit trade-off between that the decision makers are making, and I think my concern is not that I know the right answer, but that everybody in the population should participate in that decision. It's a difficult decision, but we should all participate in it, and it shouldn't just be a couple of people making it.
Like policymakers. That you just heard Dr. Rajiv Bhatia, who is a medical doctor and has a master's in public health. The article he co-wrote with Dr. Jeffrey Klausner is titled, "Most States Can Safely Relax Some Coronavirus Restrictions." Yeah. And that article, let me read the titles. Most states can safely relax some coronavirus restrictions. And that article can be found at the National Review. And then Jen Enstrom wrote another article titled, California Coronavirus Response Must Be Guided by the Data. Yes, so that's what you're saying. So we've relied on, in fact, I guess both of you would agree that this virus has been hyped because we were initially told that millions of people would die given the models. So what were the assumptions that the models used were wrong-headed? Would you agree, Dr. Bhatia?
Yeah, I mean, let me just sort of back up and I think I'm not sure I would agree with the word hyped. I think that when you have something new, unknown, scary, it's perfectly reasonable to be precautionary, at least for a few weeks, at least till you see what happens on the ground. We didn't know what was going to happen. We reacted viscerally. We reacted viscerally to pictures from China, pictures from Italy. We reacted to the model. We reacted to uncertainty. And people said, okay, we don't know what's going to happen, so let's lock down. That was an emergency crisis decision. But once you see what's actually happening on the ground, stop looking at the models. Once you actually see that your hospitals can handle the capacity, stop looking at the models. Once you see that people are actually doing sensible things and washing their hands and not going out and not shaking hands and staying home when they're sick, and the large companies are without government intervention, deciding to let their workers, telecommute as much as possible, then take a breath and follow the data and just don't react the way everyone else is reacting. I think hopefully I'm being clear.
Yeah, and in fact, you wrote that with the virus reproduction declined before the lockdown was imposed. Now we're going to take a break, but before we go to the break, I want to mention we're going to go to a break and we'll come back and continue with Dr. Bhatia and Jim Enstrom. But before we go to the break, I want to mention our new sponsor. We have a new sponsor, yes. I'm excited because I have a testimony to give. Our sponsor is Balance of Nature, and I can testify that it's been impactful, effective for me. It's you get more than 12 servings of fruits and vegetables. You take 3 tablets of the vegetables, 3 tablets of the fruits, and it makes a difference. In fact, I want to make a confession. When I started law school, in my 20s, I started smoking. Yes. I'm embarrassed. Yes. I don't like to admit that because it says I'm weak. I'm weak and I'm strong. I'm both. So in law school, it was so stressful that I started smoking. Well, and I sort of smoke now on the down low, if you know what I mean. I'm so embarrassed. I don't like people to know that I smoke. So I sort of still do it a little bit, but taking Balance of Nature has made a difference. It has made a difference. I can tell the oxygen getting to my brain is better. I've only been taking it 6 months, and I've heard that the 7th month is when you really feel the difference. But my energy level is fantastic. So Balance of Nature, if you mention Naked Truth Report, you get a discount. So we'll be right back with Dr. Bhatia and Jim Enstrom, and we'll be talking about the coronavirus, how the lockdown can be lessened the restrictions of the lockdown. We'll be right back. This is the Naked Truth Report. I'm your host, Kathleen Wells. We'll be right back. Yes, hi. Welcome back. This is the Naked Truth Report. I'm your host, Kathleen Wells. And Los Angeles cannot wait to get open, to have our businesses open, to have our economy going strong. I'm joined, my two guests today are Jim Enstrom, who wrote the article, let's see, what is it? Flawed models show why COVID-19 policies must consider total mortality. And that article can be found in the Daily Signal. And Dr. Bhatia says, his article is titled, rather, most states can safely relax some coronavirus restrictions. And that can be found in the National Review. So, Dr. Bhatia, you said something to the effect that the virus was decreasing, reproduction of the virus was decreasing before we imposed the lockdown.
Yeah, I mean, I think that's correct. I think all of the evidence says that. But let's explain, I think it's important to understand why. It wasn't decreasing just because it decided to decrease. It was decreasing because people were taking actions privately, businesses were taking actions privately to protect themselves. And then there were a couple of government actions and nursing homes restricted visitors, mass gatherings were banned that were very powerful and also reasonable. The point is that I think the point that is that at the end of the last action was shelter, stay at home, shelter in place, whatever you want to call it. It's not clear that last action was necessary to get us over the hump. It was all of the things that, and there's really no way to scientifically answer the question. So I would just be, if we're told that we need shelter in place or stay at home in order to stay in balance, I would question that assumption. I think that's the point. We certainly can't ignore it. We certainly need to take precautions, but we don't necessarily need the most restrictive actions we've already taken.
Mm-hmm. And Jim, you wrote in your article that you felt there was an overreaction. You want to elaborate on that?
Yes. And I think, again, it's because this is nationwide and the problem is concentrated in certain dense cities, primarily New York City, and also there were outbreaks in New Orleans and Detroit and other hotspots, but not nationwide. And yet this was a nationwide lockdown, which now needs to be rethought. And I thought if it's all right, I'll give some of the latest statistics on California just to give you an idea of the variation. Mm-hmm. Is that right?
Yeah, that's
So this
fine.
comes off the California Department of Public Health website as of yesterday. On May 2nd, that's yesterday, on Saturday, there were 51 counties in California that had no deaths from coronavirus. There were, of the 7 counties that did have deaths, 37 were in Los Angeles, and there were 7 others in 6 other counties. So on that's a very fortunate day. It's been much greater during April than what happened on May 2nd. But as of cumulative deaths throughout up to May 2nd, there's still 19 counties in California that haven't had a single death. There's 12 counties that only had 1 or 2 deaths, 10 counties that have had 3 to 9 deaths, and then there's only 17 left that have had at least 13 or more deaths. And so this is highly concentrated, especially in Los Angeles County. We have about somewhat over half the deaths that have occurred in the state, but overall California is a low-risk state. If you look at it, it's ranked about 30th of the 50 states in terms of the rate of death. And so these are the latest statistics. They're very encouraging for California when you have this big a portion of the state that's not really impacted. And so I think this is important. That has to be followed very carefully by the governor when he's locked down the entire state. And I've been working with several North State counties. These are counties north of Sacramento. And to give you an idea, related back to what I was saying about total mortality, the vital statistics person in Butte County found that as of the beginning of April, they had 591 deaths from all causes this year, and that compared with 714 deaths during the preceding 3 years. So that's a 20% drop, and that's why it's important to try to keep this in perspective. The 6 counties that are sort of surrounding Butte County have filed a petition with the governor to relax the statewide lockdown in those counties. And then there's another county in the northeast corner of California, a very small county called Modoc, and they're basically doing this on their own without any approval from the governor. And so we need to try to balance this up, and in Los Angeles County, where you and I are located, we need to again get the policy in line with the localization of the cases and the people that are at risk.
Well, but I don't think Governor, what's his name, Newsom is going. I just saw that. I don't think Governor Newsom is going to do that, nor Mayor Garcetti. They want to lock down and extend it. I don't know the official date, but I think initially it was May 16th, and it may even go to May 31st. But we're talking about proportionality, putting things in proper perspective, right? And as I discussed last week on the show, the unintended consequences of a lockdown. For instance, the guy stealing my car and then not being released from jail without bail. You see these unintended consequences. So initially, Dr. Bhatia, we were told that masks were not necessary. They weren't effective. Now we're told that they're mandatory. Talk to us about that.
Okay, so the issue of masks, and again, it's risk is relative. If you're asking me, should a caregiver in a nursing home who doesn't have any illness wear a mask today? I'd say yes. They're taking care of a very vulnerable population. Should somebody in a hospital wear a mask? If you're in a subway, should you wear a mask? Well, we know that people who are not, we know that for many people this is a very mild illness. They may not even notice it as an illness. So yes, when you're in close proximity, wearing a mask is a reasonable thing to keep the infection rate down. But does everybody need to wear a mask everywhere? No.
Mm-hmm. How do you feel about taking a phone call? You guys want to take a quick?
Yes, certainly.
Love calls.
Yeah, okay. Hi, Mike from El Segundo. You have a question?
They sure do. For these 30 years, medical doctors and researchers in fields of public health and epidemiology have been producing and publishing really fake science, fraudulent research, advocating and promoting gun control. It was so fake that they used false assumptions, even including that their conclusion is true, and then using that assumption to prove their conclusion is true. That's one of many examples. And this started at least in 1986 with Arthur Kellerman publishing in the New England Journal of Medicine. I'm wondering, how can we, the people, trust anything coming out of these medical, epidemiological, and public health journals as research, and anything these professionals are saying? Obviously, you gentlemen sound like you're very credible, but the point is the fields have been totally corrupted and politicized. So how can we, the people, trust anything coming out of, these so-called scientists and medical researchers and professionals?
Well, I think we should both answer, but I'll go first, and then I'll let Dr. Bhatia say this. I've dealt with this in a number of areas of epidemiology, and you're exactly right. It's really tragic too, especially here in California, where everything is considered carcinogenic, everything is considered toxic, and yet California, by the way, has the lowest age-adjusted total death rate in the entire United States for reasons that have nothing to do with all of these supposed carcinogens and toxins. It's largely because we have so many Asians and Hispanics in the state, and we also have healthy lifestyles. So it's very important for the general public like you, Mike, to try to understand this, and I'd be pleased to communicate with you. It really takes an effort on the part of the general public and everyone in this audience to stand up and try to get a true understanding of what's going on. Learn the statistics, the real statistics in California, and it's a chance to stop this. But it's going to be difficult, and it involves a lot of groups that have concentrated in California, environmental activists, different advocacy groups that have helped make this environment possible. And so that's what you can do. You can learn more about it, and I'd be pleased to communicate with you more. And then you need to take action in the sense that you can work with others that you know. You can also work with people that are on the side of accurate and balanced science and so forth. Now I'd like Dr. Bhatia to mention specifically what he feels is important on this.
Yeah, I think let's just step back for a second. Look, I think you're a person, scientists are people. They bring their values to their work. If they have a priority, they're going to focus on it. If they have a bias, they're going to find things that confirm their bias. If you were an epidemiologist and you like guns, you'll probably find guns are healthy. Now, there's nothing wrong with that. I think we just need to realize that everyone brings biases. Nobody's trying to intentionally mislead you. You need to be educated, empowered to make your own conclusions. Exactly like, we're saying you need to, don't trust everything, but find out for yourself. Look at all of the science, look at all of the research, and come to your own conclusions. That's perfectly reasonable, but I don't think it's helpful to sort of believe that the science is fake or people are intentionally trying to deceive you. Everybody is just bringing their own biases to the work that they do.
Well, Dr. Erickson, who was an ER doctor in Kern County, his information was being censored from YouTube. So there is an intentionality there, you see. I think there's a consensus, or rather fashionable science, or fashionable perspective on the science, the establishment perspective, when it's not...
I agree with that.
Right. So that is intentionality. When you censor Dr. Erickson from YouTube, people aren't getting, this is something that Dr. Shiva talks about, truth, freedom, and health. You cannot get to the truth if you're being censored the information. If you don't have the freedom to get the information, you can't get to the truth. You see?
No, I agree. There's a lot of groupthink, and it stands in the way of truth.
Okay, let's take a call now from Linda in Burbank. Hi, Linda. Welcome to the Naked Truth Report.
Yes, I heard a story that gave me the impression, and I believe this already because I experience this when I wear the mask, that masks are unsafe to wear when, you drive. And I heard this story on the Friday before last, toward the end of John and Ken's show. And I don't recall the city it was in. I don't recall if it was in California or in another state. But wherever the location was, they had to wear masks outdoors and while driving. So what happened was there was a car accident, and the driver that was at fault said that he passed out because the mask made him stop breathing.
You want to comment? Either of you can take that.
Yeah, some people with respiratory disease, they need no obstruction to their breathing. I have a patient of my own who has lung disease, and it's uncomfortable for him to wear a mask. He can't get enough air. There are those people. Again, it's not the norm.
It's not the norm. And so, how do we want to conclude? Do you want to conclude, Jim?
Well, listen, it's important for all the listeners to try to understand what Dr. Bhatia and I have written and what we've tried to state on this program, and to learn the overall perspective on this issue, that we have an unprecedented situation in the United States where there's a complete lockdown of society, and a lot of this doesn't really have anything to do with the risk for developing this disease or dying from it, and it's very important that we get this straightened out as soon as possible, because it's obviously going to have major impacts on the entire financial system in California and in Los Angeles and nationwide, and the ability of people to get back to their successful jobs, especially those that have small businesses, is on the line here. And so they have to be aware of the facts themselves. So each individual cannot rely just on the facts that come out of the daily briefings from the health officials here in Los Angeles or all over the state, or from the governor. These are, again, they're reflecting the biases of the officials that in charge.
Okay, and Dr. Bhatia, do you want to talk about your plan and where they can find it?
Yeah, let me just make four quick points, and let you guys in. Now, number one, the issue is balance. COVID is not the only thing that affects our health. We need to balance our response to COVID with the other things that affect our health. We need work to be healthy. We need to interact with people to be healthy. We need freedom to be healthy. So we need balance here in making the decisions. That means all of us. Number two, different places, different solutions. Follow the data. If we are in rural places, you don't need the same solutions as you do in New York and Wuhan and Milan. So we have good hospital capacity, and we can take steps back. For example, open small businesses, open manufacturing, open construction, let people go to the parks, wait a couple of weeks, see what happens, then keep opening more incrementally in small steps till we're back to normal life. If the hospitals get over capacity, then we may need to hold for a little bit or pull back. Number three, we really need to focus on being more targeted. Instead of making everybody shut down, focus on the places that are creating a lot of risk, like nursing homes, like shelters, like those places. Do a lot to protect them so everyone else can have more freedom. Number four, and the last point, people reacted out of a lot of fear. At the onset, that's precautionary, it's reasonable. Right now, what I see happening is that what the political leaders are doing is that they're seeing a lot of afraid people, and they're reacting and being precautionary, when they don't need to, because they're sensing this fear. And that fear is out there, and so the listeners out here need to start having discussions with, in their neighborhoods about that fear, because it's out there, and it's part of what's stopping us from getting back to normal.
And where can they find your plan, Dr. Bhatia?
You can. There's a step-by-step plan for California. It's on medium.com.
Beautiful.
medium.com. So, yeah.
Okay, thank you very much. So we were speaking with Jim Enstrom and Dr. Bhatia. Dr. Bhatia's article can be found on National Review. It's titled, Most States Can Safely Relax Some Coronavirus Restrictions. And Jim Enstrom's article can be found on the National... what is it? Daily Signal. Yeah. Jim Enstrom, Enstrom. Daily Signal. Thanks, guys, for being a guest on the Naked Truth Report. Next week, we're going to talk about Flynn and the FBI. See you next week. Thanks, folks.